You might have seen the news that a race participant died after finishing the recently completed Standard Chartered Singapore Marathon. This is not the first time something like that has happened, so I asked cardiologist Dr. Koh Choong Hou on his thoughts about the matter. And this is what he has to say.
Let's talk about the commonest cardiac causes of collapses during exercise events such as this. So top 3, in the younger age group, not so much the older. Older, usually it is due to an acute heart attack. Yeah, because they have blood buildup in the arteries really, and then that spike in activity during the competition really tips them over, right? So the older people one is heart attack most of the time. Then we focus on the younger one, right? I'm only 40, considered quite young, right? Should I be worried? Should I get screened? And what are the guidelines? So there are different societal guidelines across different parts of the world. Asia Pacific, we have our own. I was part of the working group that worked with the cardiologists around the region to come up with who needs an ECG at what age group, doing what kind of exercise. So basically, it comes down to these few things. Number one, when you train, when you exercise, do you have symptoms or not? Do you have exertional chest pain? Do you have very unusual exertional breathlessness? If you have that, please go and get checked. Number 2, your age. So what is the magic number to move this age needle? Is it 30? Is it 40? It depends. It depends on the kind of activity you're planning to embark in, right? Like, let's say if you are going to take part in an international chess competition, right? The cardio stress is not very high, right? So is there a need to do cardiac screening? No, not really. But if you tell me I'm going to take part in the Langkawi triathlon in 6 months' time, I'm going to push myself. I haven't trained for it for a few years. You know, my parents, they have high blood pressure, nothing much. Should I be worried? I would say do a screen, do a check, because you are going to push yourself really, really hard for those few hours. And you're going to train hard for the next few months as well. The last thing you want is you push yourself to a certain limit and something gets triggered and happens, right? Coming back to a younger age group where we want to know what are the common cardiac problems that really trigger such sudden cardiac events. Number 1 is this condition called hypertrophic cardiomyopathy, which is abnormal heart muscle thickening. It is genetically inherited. Sometimes they have no symptoms until a bad event happens, but it can be screened. It can be screened. So if you have a family history of sudden cardiac death in any first-degree family members, get checked for that, right? Sometimes ECG, the electrocardiogram, can detect certain patterns that suggest this, but it's not always sensitive. So someone with this condition may have a normal ECG. The only thing that can really pick it up is cardiac imaging, either with the ultrasound or with the MRI. Second is coronary artery structural issues, what we call coronary artery anomalies, where the arteries of the heart courses through an abnormal path. And certain variants of that, these arteries course between the big trunks of arteries. And during intense exercise, these trunks can compress on the coronary artery and cause sudden cardiac arrest. Again, very hard to screen. If you have exercise-related fainting, like in the middle of a run, you suddenly faint, or in the middle of the run, you're a young man, you get constant chest pain, which only gets relieved by stopping the run, get a check. Yeah, very, very hard to screen with ECG. ECG is invariably normal in this kind of cases, right? And the last one is what you mentioned earlier about one of the participants, right? Arrhythmias. Arrhythmias basically mean abnormal heart rhythm. Now remember, our heart is not just a pump, but also it has an electrical function, and that's how we capture the ECG signals. So in some conditions, very bad and unstable heart rhythms can develop during peak exercise or peak stress. Yeah. Again, a resting ECG when you're not doing anything, just lying there doing the ECG may not pick it up. Yeah. So these are the things that are discovered as the top 3 causes of young sudden cardiac death in athletes. Yeah. So if you do have a family history, if you do have symptoms, no matter your age, I will request you to get it checked.
This concludes Dr. Koh's thoughts on the matter. I hope it has been helpful to you. This is actually a segment from a future podcast episode that we're going to be publishing. If you'd like to see more such content, please feel free to subscribe. If not, till next time, take care.